Hi, I'm Dr. M, and today I thought we should just sit down and talk about queries. I know a lot of you are even new to CDI or just want to make sure you feel confident when you write them. But before we deep dive in, let me just say this. We are in 2026 right now, and I honestly feel it's the best time to start learning things differently, not just to get a certificate or crack some interview or land some job, but actually to improve ourselves at the job we will be doing so we can do it more thoughtfully. I know there are some scary headlines in the news. AI incorporation has increased a lot, almost 300% in some areas. But sometimes the fear can actually push us into action and help us improve. Right now, CDI programs are really increasing in a hospital. HCA is heavily hiring right now for CDI roles. If you want to learn this in detail, just comment CDI. We are starting our CDI training very soon. I will love to have you join. Okay, now just see what is query. The first thing, let's understand what query actually is. Query is just a polite question we send to the doctor when the chart has good clues but the diagnosis is not clearly written or needs a bit more detail. The whole idea is to help the doctor make the documentation clearer so the coding become accurate and fair for the patient. About pushing any particular code, it's really about getting the true clinical picture, right? Now let me read the actual definition from the guideline. A communication tool or process used to clarify documentation in the health record for documentation integrity and accuracy of diagnosis, procedures, service, code assignment for an individual encounter in any healthcare setting. A query may be developed by a healthcare professional or through a computer auto generated query process. So basically, it's tool to get the clarity on documentation. Okay, so when we should send a query, when we send a query when the chart shows clear clinical clues that are clinical indicators, but the diagnosis or the condition is not properly documented yet. For example, when something look obvious from the test treatment but the doctor has not written it clearly, when the different doctor have written some conflicting note, like in the case of aspirational pneumonia, if we have the clinical indicator and it's only written pneumonia, then that is a point where we raise a query. Okay, let me show you few important points from the guideline. So query may be necessary in the following: the to support documentation of medical diagnosis or condition that are clinically evident and met the uniform hospital discharge data set requirement, but with the corresponding diagnosis or condition stated. B. To resolve conflicting diagnosis or procedural documentation between provider. To seek clarification when it appear a document diagnosis is not clinically supported or conflicting with the medical record documentation. These are some of the most common situation we see every day. So now, just as important, when to query, when should we not query is also equally important. Simply put, don't send a query for every small thing because it can tire the provider. If the document is already clear, if the document can't possibly add more clarity from what's written, it's better not to ask. Okay, so query are not necessary for every discrepancy and address documentation issue in the accordance with an organization's policy and procedure. Circumstance may include lack of business need or does not add to the clarity of the clinical picture. Query sent in this circumstance can promote query fatigue. When there is a sufficient documentation to assign a valid code, no indicator that the code can be specified to a higher degree. These are some instances where we don't push the query. This help us to like query smartly, keep good relations with the provider. Finally, what actually make a query compliant? In simple words, a good query must be clear, non-leading, and be supported by real clinical indicators from the chart. We should never like suggest the answer or mention any quality score. Here are the key rules from the guideline. Compliant query practice should follow this. First, provide multiple choice answer options that are supported by the clinical indicators in the health record, which are also included on the query. So, while querying, you have to include the clinical indicators in the health record also. So, yeah. So, diagnosis answer question that are not already documented in the health record may be supported by clinical indicators surrounded by medical record. Okay, and the third include a non-leading query statement that is clear, concise, specific to the necessity of the query, supported by the clinical scenario. Fourth, the title of query are viewed by provider should be non-leading in nature and not included in impactful information. Query must be accomplished by clinical indicator or evidence that support a more complete or accurate diagnosis or procedure. If you follow these, your queries will be safe, respectful, and really, really effective. So these are the main thing I wanted to share with you today. I hope this felt helpful and easy to understand. If you want the full document, just comment CDI below and I will share the link with you, or you can just download it. It's very easily available. Starting our starting our CDI training soon. If you want to learn this in detail, just comment down CDI. Like the video if it helped you, subscribe for more simple breakdowns. Any question, just drop them in comment. I will read them all. Take care, keep learning, do your work thoughtfully. This is Dr. M. See you in the next one. Bye.